that's great.
We want to.
And Andy.
And Andy, yeah, Andy sort of knows what's going on.
Well, so I appreciate y'all being here tonight, and most importantly, I appreciate Janet setting us up and giving us an opportunity to talk. And those of us that are watching us online, I'm very appreciative of the opportunity to come and talk about our programs at the Smithville Workforce Training Center. For those of you that don't know me, I'm April Daniels. I'm the Executive Director of the Smithville Workforce Training Center. At the Workforce, we started our programming really in earnest just about a year ago. And in that time, we have trained a little over 300 people. We've trained CNAs, EMTs, HVAC technicians, welders. We've trained all kinds of people in all kinds of jobs. Lots of GED, ESL trainings. Am I forgetting anybody?
No.
Okay. So we've done quite a bit of training of phlebotomy. Thank you. Lots of phlebotomy students. So we've been very excited to see the interest that people are expressing throughout the region. We started the Workforce Training Center with the idea of serving Bastrop County, that we would grow out Smithville as a model community, which we have done. Smithville is a model across the state of Texas. We have given multiple tours to people that are city managers and economic development corporation directors and people that are interested in developing the same kind of workforce training program in their small rural community that we're doing here in Smithville. We get the train out sometimes and go around on the train and take them around, and it's been exciting to see the interest. We also, as I talk about statewide interest and statewide support, we've been very fortunate to be able to speak with our local state representative, Stan Gerdes, who worked with us to create some language for legislation that it does look like it's going to pass. I don't ever want to count my chickens, but it looks like it will pass. That legislation specifically sets up and establishes a rural workforce training department with the Texas Workforce Commission. We're very excited to have really helped lead the charge on that. Stan Gerdes just posted on his Facebook page, and his office staff contacted us by email and said it looks like this is going to get to the floor. We feel very comfortable that it will pass. So that's a definite win for Smithville as we push the importance of workforce training in rural communities. I'm sure all of you would not be surprised to hear that rural communities are often underfunded across the board. And I understand it. Funders want to get as much of a return on their investment as they possibly can. So they tend to look at urban centers. Well, here we are out in rural areas. And fortunately, we've been able to make a case that people are beginning to come out and flee away from the urban centers to the rural centers. Not to mention, we're losing the people that are so important in our community. The young people, brain drain, we've all heard that term. People are pulled away from our community for education, then they don't come back because they've established themselves in Austin or Houston or Dallas or other educational hubs, and they don't want to come back. Well, if we can offer training in our rural areas, we can keep those people here. That's economic development, by the way. Those folks will stay here, they'll get jobs, they'll buy homes, and what else will they do? They'll volunteer in our community. I'm looking at the faces of many people. There's a small group here, but I know every one of you volunteers your time. And by the way, I'm going to tell you a secret about myself. I'm 53 years old, and I'm usually the youngest person in the room at a volunteer event. That's a problem in small communities like Smithville. How are we going to keep people in Lions Club, in the PTA, in kickball and soccer and all of those things? Those places are typically manned by volunteers in your community. Our fire department is manned by local volunteers. So this has not just the effect of training people, giving them good jobs, which then leads to, by the way, health care, which they can help us save our local community hospital. We can keep those healthcare dollars in our community. All of it is a piece. It is such an important economic development tool. I want to say a big thank you to Jill Struve, our board chair, who, by the way, is also our city grants administrator, who is the best, most wonderful visionary leader and has worked really hard to help us establish this program. And our entire board, of course, has been so very important. So I know I wandered off topic there a little bit, but I wanted to give you a little update there. Coming back to the classes that we have offered, we have now just launched our first CDL class. So for commercial drivers, we intend to have our first graduation here, and I think it's not next week, but the next week, in a couple of weeks. We're also going to be graduating welders. Tomorrow we'll have a CNA class graduation at 3 o'clock at the rec center if anybody wants to come. That is the largest CNA class yet to graduate. That, by the way, is a wonderful partnership with Towers Nursing Home, also known as Regency Healthcare. They pay the tuition for those students. We provide the facilities and help recruit people into our building so that they can come and take those classes. So it's a perfect partnership. Then those CNAs can then receive stackable credentials. They could become, on top of being a CNA, they could be a phlebotomist, a medication aide, things that will allow them to stack up their credentials. And by the way, it provides us with an excellent recruitment pipeline so that we can take those CNAs and help them become LVNs and RNs. So it's a win-win for everybody. It's very exciting, and it's been really, really successful. We also, of course, now that we have finally launched our big grant, the Good Jobs Challenge grant, we launched that May 1st. We are now moving into strategic planning and a lot of things that have to do with sustainability as we figure out how we're going to grow over the next 2 years, while at the same time, grants are fantastic, but they go away. So understanding how we will continue to be sustainable over the years after these grants go is really going to be a big focus of ours. That means public-private partnerships, that means working with local employers who, by the way, get the benefit of all of these trained and skilled workers. So that'll be a big piece of what we're going to be doing moving forward. We have begun the very hard work of building out apprenticeship programs. Our sustainability director, Steph Smith, is working hard on building out that program, and in fact, we'll be launching her first apprenticeship program in the IT sector in Giddings, because that grant, the Good Jobs grant, includes a region, Bastrop County, Fayette County, and Lee County. So we're excited to see how we can build out those coalitions and build out other rural communities that are right around us to help us become really what we've already become, which is the center of workforce training in Bastrop County and in the region. I'll give you another example of a partnership. We have been talking with other organizations throughout our area. Community Action has been an incredible partner for us. They have taught multiple computer classes. They've even paid for our first HVAC class that we offered. They're going to launch our first computer class. Our computer class will be taught at our brand new computer lab. That's another facility. That facility is as a result of a wonderful partnership we have with Smithville ISD at the Brown Primary Elementary Campus. That two large classrooms, we have bought 30 computers and all of the wiring and everything that goes with it. We will launch that in about 2 weeks. We'll have a big ribbon cutting, and on June 20th, we'll have our very first computer lab in-person class right there, taught by Community Action, a really important partner for us. Yeah. We also, in this day and age, brand new day and age, we still have a real technology barrier. We do not have really good rural broadband internet access. Well, that's the job of the person in my seat, is to address those things like barriers. So how do we address that? Well, during COVID, the school district was literally parking school buses with hotspots on them out in the outer regions of their district, just so kids could have access to reliable internet. Obviously, that's not a long-term solution. So we have to work with our elected officials, we have to work with our local elected officials, with all of our stakeholders, and show that what we're doing means that we need that real, very serious investment in our area, because we have the students, we have the need right here. It's exciting to be able to see how what we can do, what we're doing, will drive those things into our community. For example, Bastrop County has invested in what we're doing through their ARPA dollars, and we received a $750,000 grant right here in Smithville. And I want to give a big thank you to Clara Beckett, our local county commissioner, who really went to bat for us and strongly advocated on our behalf. Those dollars are being spent for our people to go to school and learn how to be phlebotomists and EMTs. That's when I left off the list. We have another EMT class starting soon. We have graduated several EMTs. I encourage anyone that is interested in more information about the Workforce Training Center to go to our wonderful website, smithvilleworkforcetrainingcenter.com. Lays out all the many classes that we have open and available. If someone wants to take a class, so for example, this Thursday from 6 to 8 at the Rec Center, this coming Thursday, which since I don't know who'll be watching online on at what day and time, I will say if today is the 23rd, that would be the 25th at 6 o'clock at the Smithville Rec Center. We will be having a recruitment event. We have another wonderful community partner called BCASH, Bastrop County Accountable Communities for Health, and Community Action. They will be coming to that recruitment event and helping us sign people up for classes, explain to them how they can get involved and get set up and get registered for the courses. That what comes with that, for people that need it, are wraparound services. Transportation, child care, if you need help writing a resume, if you need soft skills like things that have to do with customer service, whatever it is that we need to do to help them overcome their barrier, we have funding to help do that. We've received funding for that through the St. David Foundation. It also is available through the Good Jobs Grant and through the Bastrop County grant that we have. Speaking of important community partners, the Smithville Hospital Authority has been such an important partner for us. They have invested now 2 years in a row to help us manage one of our other facilities, which is a building that's owned by the local Smithville Methodist Church. They have a large building across the street from their main campus. A lot of people call it the Boy Scout hut, some people call it the old clinic, whatever you want to call it. Now it's the Smithville Workforce Training Center medical training building. We made a relationship with them, put in that wonderful space, and the Smithville Hospital Authority helps us make sure we can maintain that space. Whether there's a clogged toilet, or we need to fix a problem with some desks and chairs, or we need to provide paper towels and eye wash stations. Whatever it is, those operating costs, we have to have them, and the Smithville Hospital Authority has been very generous by helping us fund those needs. So that's just an example of some of the things that are going on at the Workforce Training Center. I am happy to answer any questions you have.
That was a great presentation.
Okay.
That really was. I'm glad to see your medical program, because you talked about stacking skill upon skills. To me, that's almost like it's an apprenticeship program. So they're working at a skill, and then they can move on up, and they can still go to school and become nurses, an RN, LVN. So that's a wonderful way to do it. That keeps them involved, and people need to be involved when they're doing it. They need to be doing part of the training on the job, actually working, and I think that's great.
So Jimmy, as far as Region 2, they own 9 different nursing homes. So I mean, it's a brilliant program that they've been able to put together with Jake. So the idea would be to emulate that in other communities where there's deserts, there's not enough CNAs, there's not enough med-aids, there's not enough LVNs and RNs. So moving what we've got going on here into the other counties, Fayette County, Lee County, Caldwell County, because what we're really trying to do is, building that workforce so that people will stay in these rural communities. And there's what, 222 rural counties. I think that's the number.
And that's defined as any county that has less than 200,000.
Right. Yeah.
So, I mean, there's a lot of great things that can happen with these apprenticeship programs, and then, teaching somebody from the bottom level that's already working, taking them all the way up to be a doctor or whatever they want to be.
Yeah, because if you go, from Smithville going south, that's there's all just small communities till you get to I-10.
Right.
So, yeah. So you've got all that area.
Yes.
There's plenty of places for all of this kind of stuff to be had.
And when you think about those small communities, they have several things in common. They need workforce training in order to continue to at least maintain their current population, if not grow it. They also have facilities. They have churches and community centers. They have privately owned buildings. That's really the challenge that we have. So if there are business owners or nonprofit owners or church owners or other municipalities that want, and they're in one of the 3 counties that we serve, they need to reach out to us and let us know that they're very interested in having some workforce training brought to their community. The other, of course, major issue that we have to deal with is educational providers. They don't exist out there. We have to reach out to them, get an agreement in place with them, and bring them out here. Sometimes we have to help find an instructor and get them to go work for Austin Community College or whatever provider, Glenn Community College, whoever the provider is. We need to help recruit and find somebody to teach that welding class or to teach that help with the HVAC or whatever the class is. Now, of course, there are some exceptions to that, like nursing. Obviously, we have restrictions there. But the point of this project is for us to live and give in our own community. And for local business owners, local nonprofits, local funding partners to say, you know what, we are going to give in our community because we want to invest in our community. We want to help grow our own community. And that will only help everyone in our region. If we all look around at each other and say, nobody's coming to save us, we got to save ourselves. We have to invest in our own thing. It's already clearly working. This has really struck a chord, and people are very interested in that.
Something else that I work a lot over in Fayette County now as a part-time county coordinator. And the relationship that we're building right now, it's a desert for paramedics. Even though they've got a local hospital in Fayette County, St. Mark's, and we've got Seton Ascension here. Bastrop County's got a pretty full EMS, trained paramedics, EMTs. So that's why we've started, EMT feeds up into paramedic, which is a 2-year school. Most of the schools are in Glen Rellis, or you can go to ACC. So we're looking at a campus right now in the range to take Fayette County EMS and make that a campus and get some funders to find an instructor to where now our students aren't having to go 90 miles to Teagues or to Glen Rellis or to ACC, which is in Eldon. They'd come, Smithville could go to 20 miles down the road and go to school.
Right.
So we're looking at making a premier training center out of this already beautiful campus that's already got all the ambulances. The only hiccup right now is finding that key instructor. So.
And what's interesting about paramedic classes is there's really no reason that people can't learn how to be paramedics in rural communities. People see it as a barrier because you need to go get time in an ambulance in a place where there are actually accidents and gunshot wounds and that sort of thing. But they can spend a large part of their classroom time and their educational time in their own rural community, which will help us retain those people. Right now they think they have to go relocate. If we have to do a hybrid because of things like that, or for example, maybe an RN can't get their OB-GYN in our community, but they get everything else here in our hospitals, maybe they'll consider just going and getting their OB-GYN in Austin because they're going to be able to do 90% of their training right here in our community. Yeah.
Well, one of the good things about having this in LaGrange is because St. Mark's has reduced itself from inpatient to just being an emergency room. That's going to be, you're going to have to take those patients, if they have to be inpatients, by ambulance to wherever they go.
We've already seen an uptick right now.
Yeah, and see, that's a great thing that's going to happen because they can go Columbus, they can go to LaGrange, not to LaGrange, to Smithville or to Bastrop. So that's really going to help out with that.
And if you'll think about those healthcare dollars, right now, we can help drive the the marketing and mission of our local hospital, they have a premier imaging suites there.
Mhm.
Fantastic.
Yeah.
The head of the hospital is on our board for the Workforce Training Center. He's perfectly interested in having people come and work in his facility. Those are what's so important. If we don't maintain and hold on to our local small hospital, it is, when I was, before, in my former career as a chamber director, one of the number one questions people would ask is, tell me about your health care, tell me about your school system. Those were their two big questions. And having a hospital, in fact, the only full service hospital still in Bastrop County, and now, frankly, the only full service hospital in the region because of the changes with St. Mark's, it's a huge selling point for us.
Yeah.
And those economic development conversations, frankly, need to be had. We need to be talking about all of our strengths. The only airport in Bastrop County, the only full-service hospital in Bastrop County. Those are really important things to talk about. Not to mention a premier, our nursing home is also a premier therapy
Yes.
location.
Yes.
Physical therapy, occupational therapy. These are the talking points that I would urge people to think about. Those of you that have the opportunity to kind of lead those discussions around economic development in our community, those are the things to talk about. Our quality of life,
Yeah.
all of those things. Maybe we don't have big incentives that we can pay businesses to come here. But what we have is quality of life, infrastructure. We have an enormous amount of water, by the way, which is a huge, huge thing for us.
Mhm.
Every economic development person I've ever talked to have said, you know how much water capacity you have? I mean, there's a lot of really great things that we have going for us in this community. Not to mention, we're only 4 square miles. I think we have a friendly people right outside of our doorstep that if we sell ourselves the right way, they will voluntarily allow us to annex them, which will allow us to grow if that's the desire. I just think there's a lot of really good stories to tell, and you can kind of have the Workforce Center as a jumping off point for those stories.
Absolutely. I think one of the things, you talk about the medical, and again, if you think about it, if you're going to do electronics, you might try to find a way to do biomedical electronics, because
Yes.
it is one of the biggest fields out
Sure.
there. I mean, there's only, I think there are 2 schools in the southern U.S. that actually teach it right now, and that's a big problem because working on those machines is not easy, and it's all very technical for each one.
Yeah.
So those guys make really good money. There's not many of them, and it would be a really good feather in the hat
Yeah.
for the workforce.
That is an excellent point, Jenny, because at the Smithfield Community Clinic, I'm going to speak, we've got 2 demo chairs that have to be maintained,
Mhm.
along with the compressor systems and so forth.
Yes, ma'am.
We had a guy come out, there's only one guy right now working as a technician,
Mhm.
trained, young guy, who's been there, and $580 later for 1 visit to fix the compressor. It's like, wow.
Yes,
So
ma'am.
that is an excellent point. So where do they normally train those guys?
From what I understand, I don't know where they are, but there's only, in the southern part of the United States, they've shut down. From what I understand, there's only 2 schools now, because I was looking in that the other day in one of my training programs. So there's only 2 schools. I'll get more information
Yeah,
for
that'd
you.
be great. That's a great.
Yeah.
Well, that's the point, and I think it's important moving forward. So Janice is also one of our county coordinators for the Workforce Training Center. And the county coordinators really are going to take the lead on these things like these kinds of huddles, which is why this is so important. And having these conversations with our small communities. And I don't just mean the whole city of Bastrop. I mean Rosanke and Rockme and Plum and, the places that, McDade is a great example. They have a school district, by the way, that goes all the way to 12th grade now. So including those conversations in all of those places, and frankly, having some conversations in Maynard, talking to those folks because their residents work in Bastrop County, even though they live in Maynard. So if they can come and help and feed our local businesses, there's no reason we shouldn't train them.
Absolutely.
Yeah, and upskill them so they can continue.
Yeah, I was gonna say,
Yeah.
you had some great ideas tonight. You got any thoughts, Jenny?
No,
No.
Question about,
Please,
what is
question.
community action? Is that, it's not, I have
Kelly Frank, okay, you have Kelly, Frankie, right?
that's combined community
Oh,
action.
I'm sorry, combined community.
Use CCAs, because otherwise you get, there's another community action somewhere else. It's called.
Oh, CCA is in LaGrange and Giddings.
No, combined community
Community-
action is Giddings, Kelly Frankie.
Kelly.
Right, I'm talking about community action.
See, there is.
Bastrop
Okay,
County
yeah,
okay,
has
that's
its
what I
own,
want to know.
yeah. Bastrop County, they also, I believe, they serve Hayes County and they serve Williamson County.
And what is their organization?
Largely, they offer training, but they also do some other things that are services for people.
Okay.
There is some confusion.
Yeah.
Yeah.
I understand. My understanding is there are a whole bunch of community action offices, I think there's 13 of them, throughout the whole state, and they
That's what I was
have
wondering.
regions that they serve. So we work with both community action and combined community action. And so community action is the one that is gonna come out and teach the computer class for us
Okay.
here in Smithville. My understanding is the folks that are in LaGrange and, although I'm gonna be honest with you, I'm not sure if our local community action doesn't also do Fayette County. I don't quote me on that. I'm not sure. I know combined community action does Lee County, but I'm not sure which one is in Fayette County.
You know how we use Nextdoor to get the word out? I was thinking about this, maybe more of just a post on Nextdoor about what we currently are offering, I think would be helpful right now, currently that we're.
Absolutely, that would be good.
We haven't done that, but I'm thinking about put something.
And our
out there.
county coordinators have built out marketing plans.
Yeah.
And that's an important part of the marketing plan. We've been very fortunate so far that there's a lot of people that are very interested, and we have not really had a huge problem getting the word out, filling up our classes. Although I will say we're short some people for the HVAC class. We need some more folks for that one. And so I think that's going to be pushed back about a week so that we can add a couple more students.
Jim, and you have a website and the Facebook, so on Nextdoor, mostly push that, with the
Yeah.
links, how to get in touch.
Sure.
Because it just gets lost
Yeah, I agree.
in that space, but the reason why these posts get lost is nobody comments on them and brings it back up to the top.
Ah, good point, good point.
Yeah. I usually like to go into these kinds of things and I'll at least like it or say that's great or something,
That
right?
brings
So
it
I
back.
move it up, yeah.
And another way to bring it up, if it gets abused some, but this is a good way for you to do it, is to just remember you have the post, take it, there's edit. You don't have to do a thing to the post and then just hit save again and it moves it right back up to the top
Oh,
of the
I didn't
feed.
know that.
Yes.
See why these are good, why these are tidbits.
I've been on Nextdoor a long
But
time.
there's the other one
You
called,
can help us.
turn this in, after you make your comment, they will say, do you want to turn this into a new post? That irritates me, because that puts your subversive, your comment, which could be positive or negative, up there, and then you have to go and find the post that you were commenting on.
Yeah.
And sometimes, politically, that was, kind of a way to get your name out there a lot, but it was not a functional, I don't think.
I think that if they include everything that they want with their classes and stuff like that on Nextdoor,
Yeah, this'll be
I think
great.
you'll get a lot of likes and also a lot of where is this? How can I get involved? You'll get a lot of, and you'll have to monitor it and private message those people in order to get them.
Right, that's the challenge.
Yeah,
And
that
keep putting
once
that
a day,
link in
if you
there,
can
how to
go
get
and
to
do
this.
that, you'll be okay. I know it's hard.
So,
Working on it.
you talked about prevailing wage, I just wanted to, I don't know if you mentioned.
Well, so we do have policies at the Smithville Workforce Training Center around prevailing wages. We did quite a bit of research and realized that the prevailing wage numbers are really monitored closely by Workforce Solutions Rural Capital Area, which is the workforce board that serves our area. So we tend to set our prevailing wage number based on what Workforce Solutions says. Right now, that number is $18 an hour. My understanding is they are going to go up to $19 an hour soon. I don't know if it'll be this year or next year, but it will be soon. Prevailing wage, prevailing wage. And so there's two different
If I hire
kinds.
someone out of business, I gotta pay them $18.
No, that's minimum wage, that's different. But prevailing wage means this is how
Good job.
the minimum amount of money you need to make in order to pay your rent and live your life.
It
So,
wasn't until just this last year that I finally figured out that I'm on a, what do you call it, fixed income.
yes,
and it's getting harder and harder for me to get those
Yeah.
people in and do jobs for me.
And really, it's not
Realize it's
prevailing
always
wage, it's really living wage. Prevailing wage is what the market will bear.
Yeah.
So for example, if someone works at a local grocery store and the prevailing wage is $12 an hour, that's not a living wage. That's a prevailing wage. That's what, and there's whole giant big charts that tell you here's what typically somebody gets paid. Now, right now, because it's a workers' market, because we're at less than 3% unemployment in this region, people can demand higher wages. They can skip from one job to another. That's largely people that are not very skilled, though. Like if you have a strong skill, like you're a plumber or a welder or something, you're not going to hop jobs every month or every few months, right?
No.
But you might hop jobs every 3 years.
And
You know?
yes, absolutely. Usually a plumber will stay at a plumbing company between 3 and 5 years.
Yeah.
And then the reason they move on is because they're usually moving up.
Absolutely.
They have a better
And yeah,
skill set, so
yeah.
they're moving to
They're
another
not making
company.
vertical moves.
No.
Right. And so when we're thinking about the fact that we're at less than 3% unemployment right now in our region, the market is essentially making people raise their wages so that folks won't just get lured away for 50 cents an hour or $1 an hour. That will change. We all know the market will change. So right now we need to take advantage of the need that people have for skilled work, get them trained and get them into those jobs.
Absolutely.
The other thing, if you know folks that are already in a good prevailing or living wage job, but they want to be upskilled to the next level, for example, we're working with banks, right? And so what we want to tell the bankers is, hey, you've got a teller, the teller needs to take some classes to be a teller too, or has to do fraud, waste prevention, risk management. The grant that we currently have will pay to upskill, like we're doing it with the paramedics in Fayette County right now. So if you have people you know that are already currently in a job, but they're going to upskill and they will get a raise because they've taken the training, we can pay for the class.
Right. So a good example, aside from when Janice says EMT, when she's talking about paramedics, you might have people that are working as EMTs right now.
Right.
Well, those EMTs might be able to upskill the EMT advanced and then the paramedic. And once they become a paramedic, which by the way, you have to be able to stabilize people for any number of things out of the field. You have to have all kinds of skills to be a paramedic out in the middle of in the middle of the night and someone's in a horrible accident. You might have a head injury and a broken foot and a massive bleeding wound, and you have to be able to do all three of those things, right? And so the idea that we could then target those folks and say, you already have so many skills, why don't you let us train you to be an LVN? Why don't you then let us train you to be, or a medical assistant or something?
Right.
And then why don't you let us, when you're done with that, move up to RN? Those folks, by the way, help us staff our local hospital. I know I'm a broken record on this, but if we can keep our hospital staffed, we can keep our hospital.
Absolutely, and that is a problem with it. Yes, ma'am. You gotta have the people that can do it. And RNs and LVNs are radiation technicians.
Yeah.
All of them are in short supply.
And respiratory therapists, by the way.
Absolutely.
After COVID, I'm told, many people left that profession. And they need respiratory therapists desperately.
So one of the nice things about the grant, this particular grant that we're working on, and what we're trying to model it with all the classes that we're doing, is once they complete the course, we go to the business to get the commitment, so once they complete the course, they have the job. It's
You're
not
ready
like
to
we're
go
just
to work.
training people
Yeah.
and they don't have a job. Like
We don't want to flood the market with a bunch of phlebotomists unless
Every-
people can get hired right away as
every
well.
CDL driver already has a job. We've already got commitments.
That's the model. If we don't have a commitment, we're not going to have a
We
class.
can't have a class.
That's wonderful. That's the way to do it.
Yeah.
That's, you know.
So right now, we're looking actually for plumber commitments. I think we need 2 or 4 more plumbers to commit.
I'm sorry, I'm licensed. I'm not gonna.
You got companies that you know, see. So-
I will get the word out.
These are the kinds of things that, we get the word out and just go, hey,
Yeah, and that's really, there are people looking for jobs. I see that on Nextdoor. I see it on Facebook and the Give It and Get It and all those areas. So,
It's on all the time.
yeah, so
Be one of our great avenues.
you need to, really go out there and say, look, we're looking for people. We need plumbers, apprentices, and when you graduate from this, you're going to have a job. Come to the workforce. We want you to be there. We can help you.
We want the businesses to partner with us.
Absolutely.
So right now, there's about 67 businesses that have partnered with the workforce overall in all 3 counties. That number maybe is up to 70 now. 70 businesses have partnered, right? So by the time this particular grant is over, we will have to place 358 students in all 3 disciplines. Healthcare.
Right, so it's not just training, it's placement.
Placing. They have to be placed.
Right.
But we'd like to keep this model, right, as we grow, as we continue to grow the workforce. And they have to be placed within the 3 counties.
Well, as
It's a beautiful thing.
the market changes, and right now the market's really flat for new homes and things like that, that's where your plumbers are going to be able to stay here locally and do things. So it's going to take a little bit, but I think the market will again go from being flat to being back building again. It's just going to be a slow endeavor. If we, and that's where you'll get more people being able to work locally and stay here in the area. As for, I'm sure that Doug's always looking for plumbers to run repair trucks and stuff because it's hard to do.
Yeah.
He's one of our community partners.
Yeah.
So, and same thing with Butler. Butler Contracting is a community partner. I mean, we've got some great community partners, but we want more.
Okay.
Yeah, that are local. So,
Okay. I'll see what I can do.
thank you.
I'll start asking.
And Jenny, did you have any questions? Other questions? She's not needing to know the difference between the 2, so this is good. Thank you, Andy. Yeah, thank you.
I think that was a good conversation.
Sometimes even if 2 people come, but then that's okay because we're going to share and we're going to.
Yeah, absolutely.
And sometimes we'll have more people. So,
I know, like you did with the water thing the other night, the whole place was full. So,
yeah, it was amazing. That was
Yeah.
a good
Yeah.
overview.